Oh, thank you. Well, gosh, I don't know about all that. I just come in and try every day. That's my purpose in life, is just to do my very best on a daily basis to make a difference and to be better tomorrow than I am today, and better today than I was yesterday. So I appreciate the opportunity to speak today, and am honored to go through some of these slides. I've got 20 minutes. There's so much to talk about with healthcare. It's hard to push it all into 20 minutes, but we're going to do our best to address some of the slides here. And during this process, we're going to talk a little bit about healthcare as an industry. I was telling Cassidy before we started that, healthcare, you don't want to see people sick. You want to see people healthy, but if they are sick, you want to see them be able to stay at home and receive their care close to home. And so sometimes it can be tough to talk about healthcare as an industry, but we're going to get into it, talk a little bit about what comes from the outside into the Kenai Peninsula, and how that is an economic engine for the peninsula in general. We'll talk a little bit about the hospital growth over the years, new technologies that we've brought on over the course of the past several years, our employee numbers and emerging sectors, and then partnerships that we have, and then some of the future goals. So before we start with all of that, let's talk about our mission. So CPH mission and vision. Mission is nurturing our community by promoting health and wellness and emphasizing the wellness piece through quality health care. And then our vision is focused on the needs of individuals, guided by people's preference and values in a culture of quality, compassion, and partnership. And this vision and mission was revised about a year and a half ago through a big effort of someone in this room that I want to recognize, Steve Horn, who was the board president at that time. And a lot of what we're going to go through, I want to thank him for all of his leadership during the course of the past several years, and his partnership with me on that. So looking at healthcare as an industry, first I think it's important to understand how our healthcare system is designed. What's the structure? So who owns the hospital? How does it function? Who runs the hospital? So the Kenai Peninsula Borough owns the hospital, so all the assets belong to the Kenai Peninsula Borough. In 1992, the borough initiated the start of Central Peninsula General Hospital Incorporated, which is a 501c3 nonprofit, 11-member board. That 11-member board actually has an operating agreement with the borough, and the board has one employee, and that's the CEO. And so the system by which we have this structure, it works extremely well. We've had other organizations, other hospitals in Alaska that have asked us about our structure and why we're so successful here, and that is the start of it, having that ability to function in that way. And so some of our main services, and these are main services, we have tons of other services that we provide, but looking at our main hospital, 49 beds, we'll be seeing that increase real shortly for the fact that we're just busy. 49 beds is not enough beds for us at this current time. We've had patients holding in the ED for months because we've been so busy. And so we'll see that increase over time. And we're having those discussions in our master planning process right now, which we'll talk a little bit about later. Operating rooms, so we have 4 operating rooms in the main hospital, as well as a procedure room, 2 endoscopy suites, C-section room, and then the surgery center over here in Kenai has 2 surgery suites as well as a procedure room. We have a cath lab that opened up in 2020, new obstetrics, so a new OB department which opened up at that same time. If you haven't had anyone or know of anyone that's been in the old, my daughter actually delivered in the old OB, and she just missed it by, weeks. I wish she could have been in the new OB because it's just beautiful space. And then, of course, our emergency department, which we see about 18,000, we're projecting 18,000 visits this year. And then imaging, lots of imaging that goes on in the facility. We have 2 MRIs, 2 CTs, X-ray, lots of redundancy, inpatient, outpatient. And then, of course, the ultrasound rooms as well. Laboratory and pathology. Pathology is something that has been added over the past several years. At one point, we just farmed out all the pathology, and what we did was hired 2 pathologists and said, let's bring pathology in-house, and so that it's not going outside of our area, it's staying inside of our area. And so we did, opened up pathology. We have 2 pathologists. We do all of the pathology for the specimens in our service area, as well as Homer. So we have a courier that brings specimens up from South Peninsula Hospital, and our pathologists read those. And then, of course, rehab. We have a rehab center over here in Kenai, 2 over there in Soldotna, 13 clinics. Now, this is something that's unique for our organization, our hospital. The majority of the medical staff falls under the umbrella of the hospital, and so, which is very unique. If you go up to Anchorage, you have the hospitals and hospital operators, and most of the clinics are private practices. Gives us the ability, and we started this in, I believe, 2007, bought our first clinic, and the purpose of that was we wanted to decrease disparity for those individuals that were private pay, Medicare, Medicaid, that quite honestly the private practices just couldn't shoulder all of those individuals. And so we opened up our first family practice clinic. We actually bought it. It's over here in Kenai. We're still operating it. And then over the years, we've just added. So it's all of our primary care as well as all of our specialty clinics. We got an infusion center that's on the 3rd floor of the River Tower, and then Heritage Place is our 54-bed long-term care. And then our behavioral health program is very robust, 10-bed detox unit. You graduate out of that into a 30-day 3.5 substance use disorder unit. And then you graduate out of that into a 3.3 substance use disorder unit, which is 16 beds, where we're helping you at that point integrate back in the community, get your license back, fill out applications and whatnot. So very robust in that area. So to kind of give you an idea of money that comes from the outside of our area into our area, our net operating revenue is estimated this year at $280 million. So we bill out about $750 million, so about $750 million after we take contractual adjustments, because when you bill Medicare or Medicaid, they don't give you 100% of what you ask for. You take adjustments for that. And then we have our community benefits program. So our community benefits program is an opportunity for individuals within our community to get discounts. And so give you a great example of an eligibility. A family of 5 can make $141,000 a year, bringing in $141,000 a year, apply for the community benefits program and get a discount of 60% off their bill. And so that's something that we try to promote out there, and that's a benefit for our community. So out of that $280 million, that's after we've taken adjustments, that's before we're taking any expenses. In those expenses, we push out into our community $127 million in wages and in salaries, and then $36 million overall for the employee benefits. And so when we talk about that economic engine portion of it, there's a great deal of money that's outside of our system, outside of the peninsula, that comes in through Medicare, Medicaid, insurance companies, and funnels in, which we're able to pay out. We do have local spend as well. We want to spend as much as possible locally if we can. And so, but this just kind of gives you an idea of that economic engine side of it. We also, when you're looking at the economy, we have many programs at the hospital that are unique, and those programs help with workforce development. So we have a medical assistance program. We have a CNA program for the hospital and long-term care, where, if you're an individual that wants to become a CNA and you don't know how to get from here to there, you can apply as a student. While you're taking your didactics, we're paying you to do that. The class is free. We're paying you to do your didactics. We're paying you to do your clinical. And then when you get out of that, you have a job, you can apply for the full-time positions. And so very good program. We also have a biomedical tech program, surgical tech program, sterile processing tech program, polysonographer program, lots of programs. When we get at a higher level, we just recently, within the last couple of years, started an internal medicine residency program. And so that's taking place at Central Peninsula Internal Medicine. We have our first 2 residents that will be here in July, and then we have 2 more coming in the next July. And so a total of 4 overall. These are physicians that are going through residency who hopefully will commit to our area on the peninsula and be future medical staff members. We have a couple of workforce developments in the future. We're having some discussions on nursing. We do have a nurse residency program where UAA sends individuals down to get trained in our facility, but we're having some discussions about potentially expanding that to help individuals that go through the CNA program and say, hey, I want to be a nurse. Well, let's show you a path that we can help you get there. And then information technology apprenticeships is something else that we're looking at. And so continuing to work on providing paths for our youth to better themselves in our community and hopefully keep them here, as I'd want my kids to stay here as well. So talking about the hospital growth, one question would be, how do we identify growth? Well, every 3 years, because we're a 501c3, we're required to do a community health needs assessment. And so that's going out soon. And so this is one of our years to do that. So really appreciate anyone that when it goes out, it'll be on our website. You can click on it. You can answer all the questions. It really identifies what we need to do over the next 3 years, what the community needs are. And so if I go back to our last one that we performed, 2022, number 1 was mental wellness, mental health. So what do? We opened up mental wellness, and we have a psychiatrist in there now. We haven't been in that service before at that level. We have a psychiatrist, a psych NP. By the end of this year, we'll have 3 psychiatrists, a psychologist, and a psych NP. And so really that kind of helps drive what the community's needs are, helps direct us on what to do. We also look at wait times. A great example is several years ago, to get in to see a neurologist, it'd take you about 3 months. So we hired 2 more neurologists, and now we've got 3, and the wait time has been brought down. We also look at our medical staff and work with them on what they're sending out to Anchorage, and so that we can keep those services here. And then we have the capability of looking to see what surgeries are pushing out of our service area, so that we can concentrate on bringing those services in-house. Looking at our growth over the last 5 years here, and again, I point to Steve over here because he intimately knows a lot of these that started up. Of course, we already talked about the new OB department and the cath lab. That was one big project. We opened up an urgent care over here in Kenai. That urgent care is staffed by emergency room physicians, and so you could see an emergency room physician one day at the hospital in the emergency department and see that same individual over here in Kenai for a much cheaper price. And so opened that over here in Kenai. Mental wellness came straight off the community health needs assessment. We brought on 2 hematologists, oncologists. Prior to, we just had 1 medical oncologist. So we've added that service, bringing on the hematology side of that oncology service. And then, of course, added many physicians as far as the physicians that we see in our internal medicine. We also brought some on in family practice as well, and additional pediatrics and neurology and a gastroenterologist, and opened up our diabetes clinic. One of the items on our community health needs assessment was weight, obesity, diabetes, and so we opened up a clinic to address that. We've also brought on a hip and knee robot, and so that's something that when we look at emerging sectors in healthcare, robots are a big topic in that. And then, of course, as we talked earlier, we increased our bed capacity in our detox center. We have that detox center. We increased that by 3 beds so that we could address issues and shortages there. I just want to I know this is a busy slide. There's only a couple things that I'm going to note on here. This is our statistics last year compared to what we're projected this year. You can see they're all in the green. Births, we're looking at about 392 births at the hospital this year. I also want to point out the emergency room visits, 18,000 emergency room visits, which is up 1,000 from where it had been in the past. There's only one other one that I want to look at. Really, it's two. When we look at family practice clinics, so this is access to care. That was on our community health needs assessment too, the top 8. Number 6 was access to care. People didn't have access to care. And so we brought on additional physicians, and we're looking at just under 10,000 additional visits this year compared to last year, and that's a lot. That's just due to access. So new technologies at the hospital. We have a Da Vinci robot. General surgeons use that, as well as the GYN surgeon. We'll be getting a second robot this year, the Da Vinci 5, to give us more capabilities. We got our ROSA hip and knee robot. We're looking at a Medtronic's Mazor X spine robot right now that has not gone to the board yet, but that's something that we're looking at. Rapid AI is another technology advancement, and so this really has to do with individuals that come in and they have stroke-type symptoms. We can get the CTs, get the images done as quick as possible, run them through the rapid AI, and it's much quicker. Helps us care for those patients much quicker. So that's, and then Copilot is a scribing system. So if you've ever gone to see your doctor, now you might get their back turn and they're typing, or maybe they're typing and they're asking you questions. We have capabilities now that we're piloting where it basically it's on their phone and they're having a conversation with you eye to eye, and it's scribing for them. So when they walk out of the room, there's a note that has everything in there, gives them more time with you versus them having to put that extra time in. So that's pretty exciting. Employment numbers. I love this slide because I go back to 71 and look at that. 53 staff members overall, 3 doctors, 5 nurses. Pull that all the way in. Of course, we don't have the payroll information from back then because they probably didn't even keep it then. It was, it was probably so small it wasn't even it wasn't material, right? Now you take it all these years into the future. 1,272 employees right now. That doesn't include those individuals that we're looking to bring on that we have on our website, and so it's well over 1,300 if you add those in, so 1,300 staff members. We've got 168 doctors overall. Those are all categories, so if you're full-time, permanent, temporary as well. 295 nurses, and then that figure that I gave you earlier, the $127 million overall in payroll that we send out. Emerging sectors, so things that are going to happen in the future. Some of these are happening now. Mental and behavioral health solutions. So identifying how we address individuals, not in the emergency room when they're in crisis, but how we address those individuals before they're in crisis. And so one of the programs we're working on right now is mobile crisis, really ramping that up across the service area. And so that's coming soon in a heavy fashion to address that. And what that does is also brings down that cost of health care, right? So if we can address issues with individuals before they're in crisis, they don't come to the emergency room, then there's not a big bill, and helps with the Medicaid, Medicare, commercial insurances. Home care and non-acute care delivery is a big emerging sector. That's something that we definitely need more of in our service area. Clinical wearables and remote monitoring. So a lot of people wear rings now. I know a couple of individuals that have rings, and it tells them how much they sleep, good sleep, and where their does their pulse and whatnot. That's something that is going to continue to be looked at, as well as the remote monitoring. When we look at remote monitoring, being able to have individuals at home, and we're monitoring them, capable of monitoring them from the doctor's office. And so when they're having events, we can address those in a much quicker fashion. And then generative AI and in healthcare automation. When we really talk about this, scribing is a great example of this. Scribing, the robotics is another great example. At some point, being able to self-schedule and use AI, so you're not going through a person, you're going through a self-scheduling process. Reminder calls as well, and so a lot happening in that area. This doesn't include every partner that we have. The list would be way too long, but these are just some of the partners that we have that we work with routinely. 100% Communities, Change for the Kenai Community, or Kenai Community College, Alzheimer's Association, of course the Hospice of Central Peninsula, Aurora Integrated Cancer Foundation, which they have the radiation oncology, and then several others. Great partners. The last three I could not put on here. Kenai Peninsula Borough and our mayor are great partners for us, and we really appreciate that partnership because it helps us to succeed and make a special place for the community members that we have here on the peninsula. And then our medical staff, that's always a great partnership in our community members. Having that partnership with our community members is important. Some of our future goals, we're going through master planning right now. In that process, we're trying to determine what facilities that we're going to need in the future. Right now, I can tell you we're short, or we have an aging population, and we're short on long-term care beds, and so that's something that we're looking at. We will be looking at in the future. These are very premature discussions right now in the master planning process. We should complete that process at the end of July. We started it in November. We're just about to get into phase 2. Wellness programs, working on well care versus health care. If we can keep individuals healthy and well, then they won't need as much health care. And so that's something that we're really focusing on. Medical hospice is something we need in our community, and then increased cardiology coverage are some of those. Questions. I'm up for questions. I don't know where I am on my time. I've probably blown it all, but if I'm good, yeah, if I do blow it, you just guys say, hey, get the hook to pull me out. So this. I've got to tell you, and I've said it many times in the last, even in the last week, the healthcare system you have here is an anomaly. It's a phenomena. When you compare this healthcare system, and it's all the decisions that have been made over many, many years. If individuals here can look back and think, if you were here in I think it was 2010, there was discussion about selling the hospital. And it was turned down at the 11th hour. We're not going to sell to the for-profits. We're going to keep it within. And that decision was pivotal. We pay all of debt service, and so it's not that the community does not pay taxes to operate the facility. There is a mill levy of 0.01, and that only helps to fund some of the audit that's performed on an annual basis. The borough is required to do an audit of all departments, and we're a department. And so aside of not taking any of those, I look at 2010, and the taxpayers threw $2.1 million at the hospital in operating taxes. We don't get any of that anymore. We gave all that up back then. And if the facility had been sold to a for-profit, you wouldn't have the community benefits program, the opportunity to get discounts within the community. And I think over the course of that time, I think $88 million is about the dollar figure that we've given in free care since that decision was made. Paid all the debt service over the course of those years. The Mountain Tower was on a GO bond, and we paid that off last year. And we've got 2 revenue bonds that are out there right now, one for the River Tower and one for the Cath Lab OB project. And one of those will be up in 2029. Again, we pay all those debt services as a hospital. The community doesn't have to pay those. And so it is an anomaly. It's an amazing an amazing facility, amazing healthcare system. The rest of the world down south is on fire. There are dumpster fires everywhere in healthcare. Facilities that are wondering if they're going to make payroll this week, and we're not one of those facilities. And I just want to thank, I want to thank everyone from that one moment of saying we don't want to sell the hospital, we want to continue and we want to do it right. And that's everyone from the borough assembly at that time, the board, administration, all the changes over the years and whatnot. And so big thanks to all those individuals that were part of that for making your hospital, your healthcare system great, helping to lead it in that direction. And any questions?
That's a good point.
Sir?
You mentioned using AI. You mentioned using AI for the good. Yep. You had that good result. Yeah, of course.
Yeah, that's a great question, and one that I ask all the time as well. How is this going to impact? Knowing that what we want to do is we want to control healthcare costs, but we also want to do things much more efficiently. We don't want to lay off people. It's kind of like when COVID hit, we didn't lay off anyone. We held them all harmless, and because we knew that if we didn't do that, it would impact our community, our economy, as well as the loyalty that we had within that. I can tell you what the one area that we're in right now, rapid AI is totally different, and we're using that to help diagnose individuals quicker so that they can get care quicker. The one impact that I can tell you that the other piece that we're dealing with right now is that scribe system. And what that's allowing us to do is if you're a physician and you used to have to do your notes either after the visit or during the visit, you're spending more time on that piece, what they call clicks. If you're in healthcare, they're thinking, well, it's that many more clicks for me. They're writing those notes. Now they don't have to do that. So really what they're doing is they're capable of seeing more patients. And so when you look at those figures that we see in the specialty clinics and the family practice clinics, some of those doctors are piloting that right now. And so it's actually not going to take away from the workforce. It's going to open up access. Now the self-scheduling in the future, the reminder visits, that does take a task away from an individual that's sitting on the front line, but it allows them to pay more attention to the patient and give more. It's not a matter of decreasing overall. It's a matter of increasing quality of care. I love that question, though. I look at AI and I'm very cautiously optimistic, and I think everyone should be cautiously optimistic and thinking about the impacts of AI into the future. And so, great question. What else? Well, if not, I really, like I said, I'm honored to be able to speak today. Appreciate this forum, the opportunity. Cassie, thank you so much for allowing me to be here.